What would it be like to live in a world where you leave a trace wherever you go, and people could find out where you have been when, down by the minutes of the day? That's the new reality that some people in Korea have come to accept as the norm as long as the COVID-19 outbreak persists. Korea's practices of containing the outbreak has piqued global interest, especially since the country is managing clusters after clusters of infections without resorting to extreme lockdowns implemented in other parts of the world. The COVID-19 outbreak hit Korea earlier than most nations, making it the largest epicenter of the outbreak outside of China by mid-February. But in 2 months, the country managed to bring down the new infections from the 900s to nearly zero. Experts that we spoke to, like Dr. Kim Woo-ju, said there was no secret in Korea's success so far with containment of COVID-19.
Korea's battles against viral outbreaks stretch some 20 years. There was an outbreak of measles in 2000, severe acute respiratory syndrome in 2003, swine flu in 2009, and then the Middle East respiratory syndrome in 2015.
The Middle East respiratory syndrome landed in Korea in May of 2015. The first person infected, a man in his 60s who started showing symptoms upon his return from a trip to Bahrain, went from hospitals to hospitals in search of a diagnosis. It took him 9 days to finally be diagnosed with MERS. But by that time, he had infected dozens of others who continued to infect people at a rapid pace, leading to 186 cases total that year, the highest number outside of the Middle East region. Kim said that it became evident to health authorities then that early detection of infection is crucial in containment of a viral outbreak.
As Korea experienced different outbreaks, its contact tracing system evolved as well, moving on from utilizing GPS locations of phones and CCTV footage, and now onto QR codes and mobile applications on self-quarantine and self-diagnosis. All kinds of IT technology are being used now.
Using such intensive tracing methods, Korea Centers for Disease Control and Prevention has been able to trace thousands of contacts of infected persons in each cluster of infections. When an employee of a call center in Guro district in Western Seoul tested positive on March 9th, health authorities tracked down 216 people working for the same company in 3 days and identified over 16,000 people who had passed by the building. When new cases were traced to clubs and bars in Itaewon in early May, health authorities tracked down within the week over 10,000 people who had been to the clubs or had come in contact with those who have, and tested everyone.
They are effective in locating the possible contacts of an infected person, but I think some are too extreme and may be violating personal privacy rights. They only need to share the time and location. But if they are sharing extra information about the person that says something about their private life, then they are violating individual privacy rights.
There has been some backlash over collection of personal information in the name of public health. When some individuals who were at clubs in Itaewon from late April to early May refused to undergo testing for COVID-19, the city government of Seoul assured the public that the tests could be taken anonymously. We spoke to an expert who has been watching all this from abroad.
Every democratic system has a legitimate right to deploy emergency measures when faced with something as extraordinary as the COVID outbreak. That's absolutely normal in any democratic constitution. The risk here is those emergency measures become the norm. The real danger here is that citizens start to see this as a normal price to be paid.
In the world of COVID-19 pandemic, some citizens say they do feel safe in Korea because such intensive tracing methods have led to a successful containment of the outbreak so far.
There were 2 applications. One was a mobile self-diagnosis app, and another one was a quarantine app. It was difficult to enter the country without downloading the applications, so everyone had to download them and show the officials at the airport. We also had a process of inputting our personal information into the application. If you think about it, the reason why I had to stay quarantined was because there was a possibility that I could be carrying the virus. I think there is a difference between being told to stay at home with no further information and being told to stay at home while getting regular updates from the officials in person when they visited to check on me, and also receiving care packages and such. To be honest, they helped me feel protected rather than violated of my rights.
With no end in sight yet in the battle against COVID-19 in Korea, Koreans these days register their personal information like their names and contact information whenever they enter a building, with some even requiring a QR code registration that will send the personal information straight to the health authorities. Will this be the new normal in Korea? Some say it shouldn't be, but we have yet to see how the situation will pan out from here.